OMR is not a non-clinical subject.
One cheat code for passing OMR viva.
The magic formula in today's time, as I have said before also, is smart learning.
Should students focus more on textbooks, lecture notes, clinical cases, or even mind maps?
So that's a trick question.
Is it necessary to start reading OMR from the third year, or can it wait until the final year?
That you can bunk your lectures and still pass.
Welcome to our podcast where we take the scariest dental topics and make them, well, not so scary. I'm your host, Dr. Anushka, and today we are talking about a subject that has haunted every dental student at least once: oral medicine and radiology. Yeah, I see you nodding. But don't panic just yet because we have got someone who can break it all down for us. Joining me today is Dr. Ria from Medicine Go, the go-to platform for cracking dental concepts. She is here to show us how actually we can study OMR, what we have been doing wrong, and how finally we can all pass that viva without breaking a sweat. We are also addressing some hot topics like why radiology gets such a bad rep. And yes, we are going to stir up some controversies. Without further ado, let's get started. Hi, Dr. Ria. Thank you so much for joining us.
Thank you so much, Dr. Anushka, for having me here. Thank you, Medicine Go.
So let's kick this off with some quick introductions for our audience. Dr. Ria, you have had quite the journey in the dental world. Could you tell us a bit about your professional background?
Yeah, so keeping it short, the past 14 years of my experience includes academics, that is teaching students oral medicine and radiology, practicing oral medicine and radiology, CBCT scan reporting. I've got especially trained in TMJ treatment and considering the holistic approach that's required for my patients, I've also acquired a degree in psychology.
Dr. Ria, those are some incredible achievements. All right, let's start with the first segment: how to study for OMR. But first, pause this podcast, grab your chai or coffee, and get comfy because you all are going to want to have notes for this. All right, let's address the elephant in the room. Why is OMR like the dark horse of dental education? People either love it or they are terrified of it. What is your take on this?
So I think when students are introduced to OMR, especially radiology, it's all new to them. Like, for example, prosto, conservative and all, they are doing something related to it right from the first year. So by the time they come to final year, they have some kind of familiarity towards those subjects. But in the final year, when it comes to OMR, they're suddenly introduced to lesions, suddenly introduced to radiographs, and it's all like totally new and they don't know what to expect, right? So
Right.
I think that's where the terrifying factor comes into play. But then once you get familiar with it, and if you love the idea of connecting the dots to make a final picture, you will love it.
Yeah, totally makes sense. I mean, final year is really a bummer. So tell us what sparked your interest in oral medicine and radiology?
Yeah, so I remember during my third year of BDS, when I was posted in the Department of Oral Medicine and Radiology, me and two other students, three of us were assigned a case and we were asked to come to a diagnosis. So I think the whole process of clinically examining the patient, making a list of all the findings, and then going back to the books and referring various books to see which condition has all these findings, and finally arriving at the diagnosis, that gave me a real high at that time. So it was like putting together pieces of a puzzle to, complete the bigger picture. So
Right.
that got me really excited. So I think that was the time I had made up my mind that I would do an MDS in oral medicine.
Okay, next question. What approach do you recommend for students starting with OMR? I mean, if someone's starting from scratch, what is the first step that they should actually take to understand OMR?
See, every subject you have to study, right? So I have noticed students stepping into the world of OMR with a lot of fear rather than curiosity.
Yeah.
Okay. So the first step would probably be, I would tell, I what my suggestion would be. See, they would have this fear because of the textbooks. They would have seen the textbooks, and it's so much. It would scare
Yeah.
anyone, natural. Or their seniors would have warned them about the subject.
Yeah.
I feel the first thing is to begin with, your mindset. You come with your mind filled with curiosity and not fear. Do not pre-assume anything about a subject, that you yourself have not dived into, right? And with the right resources and a systematic method of studying, OMR will definitely be used.
Great advice. Now, let's talk study methods. So, should students focus more on textbooks, lecture notes, clinical cases, or even mind maps? And let's be honest, most students are cramming 2 nights before the exam. So, what is your strategy for avoiding that last minute panic?
So I would say you have to collect, important bits from textbooks, from cases you see, from the lectures, and you sum it up into a mind map. So yeah, so today I feel mind map is, the way to go. It'll definitely help you in avoiding that last minute panic.
And when you can actually have access to very carefully curated, ready to read mind maps by MediStudy Go, why not? Right? All the problems solved. Moving on, are there specific areas of OMR that students struggle with the most? And how can they overcome these challenges?
Yeah, so I think in OMR, differential diagnosis is the place where students are struggling. So be it lesions from medicine or different kinds of radiolucencies from radiology.
Right.
So and MediStudy Go has made some amazing videos on these topics, making them simpler to understand with visuals that will help you retain. So yeah, so I think it'll definitely help them overcome this difficulty.
Yeah, that was super helpful. In fact, you people must check out MediStudy Go's free videos on YouTube and also on our app. Let's move on to one of the biggest challenges, radiographs. How do you go from staring at a random black and white blob to confidently diagnosing a lesion?
Okay, so to master radiographs, you have to know the basics. Okay, first, such as landmarks and the errors that is visible on the radiograph.
Right.
And then you have to be thorough with the differential diagnosis of, unilocular, multilocular, all these kind of lesions, right?
Yeah.
And of course, most important is practice. So keep looking out for radiographs whenever possible. The more you see, the more familiar you will get.
Right. So it's all basics and practice and a lot of practice. Next question is an interesting one. Is it necessary to start reading OMR from the third year or can it wait until the final year?
No, it would definitely help if you can cover the basics at least in third year, and then get into the depth of the subject in the final year.
Right.
I think it will help. Yeah.
Right. Totally agreed. And how often should students practice radiographs to get better at it?
Oh, you can't put a number to it. And I cannot stress enough. More and more and more. More the better. Always.
Yeah, no doubt about it. And for all the visual learners out there like us, I'm sure MediStudy Go courses come in handy for practicing radiographs, right?
Absolutely. MediStudy Go is an excellent platform to which will help you practice radiographs, with case scenarios and visuals that will help students gain confidence in interpreting radiographs. And it is definitely one of the best tools which will help you ace OMR.
Right. Okay, so that sums up with the main segment. And it's time for rapid fire round. And I'm going to hit you with some quick questions. Okay.
Okay.
So, are you ready?
Yeah, fire away.
Okay. So, favorite book for OMR?
My favorite book would be the book of Differential Diagnosis by Wood and Gauss.
Most challenging topic in OMR?
Temporomandibular joint dysfunction.
All right. Best advice for handling exam stress?
For the spiritual, I would say prayer, and for the others, meditation.
Good one. One thing you wish you knew as a dental student?
So, not more as in new, but I wish we had the online resources that are available now to study from.
Right. That is a bliss. Most rewarding part of being an OMR specialist.
Oh, definitely. The satisfaction you get when you are able to diagnose a case.
Right. One myth about OMR you'd like to debunk?
OMR is not a non-clinical subject.
One cheat code for passing OMR viva?
Okay, so you have to focus now on towards, smart learning. Hard work helps. Yes, you have to work hard. But in today's age, you need smart learning as well.
Right. One oral condition every dental student must know.
I think that would be candidiasis because you see it in various forms in almost all age groups.
Right.
So, candidiasis.
Definitely. 3 words to describe MediStudy Go.
Okay, so MediStudy Go will help in smart learning and it makes every subject interesting and easy. So the 3 words I would use to describe MediStudy Go would be smart, interesting, easy.
Worst advice you've heard while you were studying OMR?
That you can bunk your lectures and still pass.
True that. Okay, so that sums up with the rapid fire round. Let's get controversial. Is OMR undervalued as a specialty compared to other branches of dentistry?
That would totally depend on the OMR specialist himself. I think because it's like the current, trendy question, is dentistry undervalued compared to other professions? So I feel it is on you. You're the one who can make it valued. You're the one who can make it undervalued. So it's the same way, if you can stand up for your specialty, if you can show that you're making a difference just as much as how all the other specialists are, then, it won't be undervalued. So it all depends on the specialist himself.
Right. True. Do you think the curriculum for OMR in dental colleges, it is outdated?
Some topics, yes. Like, I think TMD needs to be updated. And I think forensic and medical emergencies and all have to be given more importance, at least in the UG level. Yes.
Right. Okay. Now, question of the hour. Can AI eventually replace OMR specialists?
Not at all. Because I think AI can be of assistance or it can even augment your practice. It can be a support. It can help you do things better or faster. But no, it cannot replace a specialist.
Is there a gap between what is taught in colleges and what is actually required in the practice?
UG level, I think there's a huge gap. PG level, I think the PGs are more closer. But yes, there is a huge gap in the UG level. That's my opinion.
Right. I do think there are a lot of things that we are not taught, but we see in our clinical practice. Yep. Okay. So final question. What is your take on students skipping lectures and relying on YouTube to study?
So that's a trick question because I also find YouTube videos very interesting.
Yeah.
So YouTube videos will help you study. Yes, it does, definitely. But I think, the people who are taking your lectures are all experienced specialists, right? So it is very important that you get their points. That'll help you in your viva. That'll help you in writing your exam as well. And of course, the main thing, you need attendance to sit for your exam. So if you want that, you better attend your lectures.
Yeah, I'm with you on that. And you guys better be listening to her. Okay. All right. Dr. Ria, before we let you go and save you from any more of our questions, here's $1 million question. What are your top 3 hacks for mastering OMR? And if you could throw in a secret or a magic formula, Like for not cramming the night before the exams, that would be fantastic.
Okay, I wouldn't call it three hacks, but yes, the magic formula in today's time, as I have said before also, is smart learning. Okay. You
Right.
cannot sit and write notes and study your notes and all that's no, you can't. You don't have the time for it. So smart learning means through mind maps, mnemonics, word webs, flow charts, all these things. So if you know how to do all these, work through all these, it'll definitely be easier.
Thank you so much, Dr. Ria. You've made OMR sound so much fun and easy. Who knew even that was possible?
OMR is fun. It's definitely fun. You just have to know how to tackle it, right? So, like from the story of David and Goliath, you just have to be David here. And MediStudy Go is the perfect platform that will show you how.
Right. And to all our listeners, I hope you're feeling inspired and less terrified of radiographs now. Remember, folks, the key to OMR is mind maps, mnemonics, and apparently practice. If you loved today's episode, do not forget to hit subscribe and stay tuned for more expert tips and advice. Until next time, keep those radiographs clean and your stress levels low. At least try to. Catch you in the next one. Thank you, Dr. Ria.
Thank you so much. Thank you so much.
Wait, there's more. But before we go further down the rabbit hole, subscribe to our channel.